to improve social work, the easiest, most cost-effective way is to work with and support and empower social workers. There's a little secret about social workers. We know what we are doing. We know how to handle some of the most difficult situations known to humanity. We can provide you as politicians, as governments, as people who aspire to government, we can provide you with solutions to the problems that you have. But you must allow us to do social work. You must support social workers to do social work well. And the way to do that is to give social workers back our profession.
And from my own personal experience, I had my first child, who's now 13. When I was 17, I was not quite out of care, but living independently. And it was my own social worker who, with me, took a stand and fought for me to have the right to raise my child who was going to be removed from my care at birth and be put up for adoption. And I was so lucky to have that social worker who put her head on the line and fought tooth and nail for me to keep my child. And, you know, 13 years on, I hope I've done everybody proud and justified the rightness of that decision.
That the establishment of the college will be an important step forward for the social work profession. It will represent, in many ways, a fresh start in terms of the profession's ability to speak for itself, to demonstrate high standards of practice and play its full part in the wider process of reform, which we know is so vital for all those that you serve. The government very much wants to support the development of such a body for and of the profession, and I hope that we will be able to make real progress in doing so very soon after the task force makes its report. We're all here because we want the very best for the social work system and for the profession, so that the profession can protect and support our most vulnerable children, young people, and of course vulnerable adults.
We still find social workers who are not quite sure whether they want to be a profession, and who, as many of the journalists and others that I've talked to over this time have described to me, as somehow or other epitomising being victims. It is an opportunity, I think, for social work itself to step up to the plate. We won't be successful in our work in the long term, won't be successful until social work grasps that.
The social worker degree, vital though it is, and it needs to be improved, is one of the easiest degrees to get onto in the country. 2 grade E's at A-level will get you off a social worker degree. That's too many people doing that social worker degree and they're not going into social work. Too many are then going to social work and dropping out after a year or so, and too many people who are not going to be serious social workers are crowding out serious potential social workers on many of the training placements, which are hard to get onto. So there is a serious question mark about the quality of some of the people coming through the system. And it's no good just to talk about numbers anymore. We need a serious injection of quality new recruits into the social work profession, properly trained, particularly...
Very briefly, on the other agencies involved, whilst it was right that Haringey was first in line for examination and criticism and all of that, because they were the lead agency, there were other agencies who had very similar failures. Much of it to do with something that I'm very concerned about, which is that the pendulum has swung too far towards management and against clinical and professional opinion. It seems to me that management can overrule professional opinion on almost every occasion. It certainly happened at the Safeguarding Board in Haringey, where both a senior social worker and a police officer said that the child should be removed, but was overruled in a sense by the way that committee was run.
Let's remember also that good social workers can and do save and remake lives. Everyone as a service user, when we talk with them as a service user organisation, always stresses the importance of that relationship. Get to know them early on to prevent things going wrong or getting worse, to build that trust that's crucial. As I say, it's that relationship that over and over again in research and consultations, service users say they value. That trust and relationship between them and social workers. This is the social work that service users repeatedly say really can help them, based on social worker qualities of dependability, warmth, respect, treating people with equality, of having a fellow feeling, not judging them, offering practical as well as emotional support, having empathy, and above all, really listening.
It's been very good to be here today and talk directly with social workers who are an incredibly important part of making any recommendations that the task force produces actually work. We think that government has to take the lead, but local government as a major employer and other employers have to contribute. Universities have to do things differently as well, but social work too needs to change, and social workers themselves have to stand up and be serious about being a profession.
Really, the key message for social workers is that they are hugely powerful, and the decisions that they make have a profound effect on people and families' lives.
Social workers just have to take back our profession, and all the warm words we hear about the future for social work haven't actually included very many which actually empower social workers, empower the social work profession, and sustain changes in social workers' own independent organisations. And until we get changes which are accountable to social workers, nothing will work.